my name is Kayla Campbell and I'm a student nurse at the University of South Alabama. And today I'm going to be performing a wet to dry dressing change. So I would like to begin by saying when you perform this procedure, you have to have a sterile field and you have to maintain that sterile field. And to maintain it, you have to have a working surface that is waist height or above, and your arms are supposed to stay waist height or above. And if you drop them below, it contaminates the sterile field, as well as having just a table that is below waist height. It contaminates the sterile field also. And I do acknowledge that both of these things would be wrong normally, but I am working with what I have, and I would not do it in a hospital setting or clinical setting where I had an appropriate height working surface. So I would like to begin the procedure by looking at the order form and the hospital policy. And then I would gather any supplies needed, and I have them all in front of me. So I would then perform hand hygiene, which I have done in another video, and identify the patient with two identifiers. And so here we have Mr. Jaguar Jones, and his date of birth is 8/25/1963, and it does say that he has an allergy to penicillin right here on his wristband. So I would then explain the procedure to Mr. Jones and shut the door or any curtains to provide privacy for the patient. I would then position the trash can where needed and perform hand hygiene again. I would then raise the bed to an appropriate working height, lower the side rail, and position the patient comfortably. I will now apply my goggles and clean gloves. So now I would move any gown or sheet from the patient while providing as much privacy as possible, but also making sure that I will not touch them or accidentally hit them and contaminate the wound or suture line. So I'd start by removing this ABD pad, making sure that I take the tape towards the wound. So now I would remove this towards myself and look for any drainage, and I would note the type of drainage, the amount, the color, the consistency, and any odor present. So I will now remove the inter-wound packing. And I would like to note that I am using paper towels instead of gauze, and paper towels do not perform as well as gauze in this procedure, so I would like to note that. Now I would look at the wound and look for the size and the type of tissue present. I would then palpate the peri-wound area, looking for any redness, edema, or noting any tenderness that the patient mentions. So now I will dispose of this, making sure to go glove to glove, aiming my hands towards the trash can and skin to skin. So now I'm going to move my order form, and I'm going to open my dressing change tray and remove the sterile field, making sure to only touch the 1-inch border. Removing that. Okay, I will now empty the contents of the tray onto my sterile field, making sure not to put my hands in the tray, only keep it on the outer edge, and making sure that my tray does not touch the sterile field itself. The contents, I'm sorry, dishes moved and it scared me. I apologize. Again, I would make sure that the tray does not touch the sterile field while dumping, and that the materials in the tray do not touch the 1-inch border. Okay, so now I will grab my saline and I will look for any expiration date, or I will look for the expiration date and make sure that it is in date and usable. I will then palm the label, remove the cap, make sure to hold it upwards, and pour my saline into my tray. and then replace the cap and set it aside. I will now don my sterile gloves. Making sure to only touch the border as well. I'll start with my dominant hand, making sure to go skin to skin, and then glove to glove. I will now move my gauze into my saline. So I will start by cleaning the suture line. Make sure my gauze gets wet first. Alright, so I will grab a piece of gauze, and since these are paper towels, they absorb a lot of the saline, and I'm going to make sure that I do not touch the wound or the suture line itself, and I go from area of cleanest to dirtiest. So I'm going to start in the center and do a straight line and dispose. Same thing, and I'm going to move to the right side. And dispose. And then move to the left side. Making sure not to get any drops on my sterile field because that would contaminate it. Left side, dispose. So now I'm going to pat dry the suture line with a dry piece of gauze and dispose of it also. I'm now going to fill my open wound. And with gauze, you normally fluff it really well, open it up and then fluff. With a paper towel, it's just about next to impossible to do that wet. And so I'm going to try my best. Okay, and then fluff, put it in the wound without touching the peri-wound area. Fluff as well as I can, place it in. And again, gauze works much better while doing this procedure. Fluff, insert. I'm now going to place a dry piece of gauze over the wound. I will now place the ABD pad over the wound, making sure not to touch the bottom side that will cover the wound. I will now remove my gloves, aiming towards the trash can, making sure to go glove to glove and skin to skin. I will now tape the wound. And I ran out of the tape that came in the kit, so I would like to note that I am using a different tape. Measure, then cut. So once I get done doing this, I would take an additional piece of tape and put my name, the date, and the time that this dressing was changed. I would then raise the rail, or I would then position the patient comfortably, raise the rail, cover him back up, make sure he's nice and good and covered, raise the rail and lower the bed. I would then perform hand hygiene and dispose of all of my mess properly, and after that I would go to the nurse's station or the computer in the room and document my findings, which are an intact suture line, an open wound, and I would also document how the patient handled the procedure.